All right. Well, good morning, everyone, and welcome to today's edition of Medicare Made Easy. This is a regular Facebook Live broadcast that Blue Cross and Blue Shield of Louisiana, we host this to share information about health topics that we think will be of interest to adults 65 and older, especially the Medicare crowd. But today we're going to be sharing tips on how to get the most out of your healthcare coverage as we start the new year. We're also going to talk about ways you can stay healthy and fit, kind of keep those New Year's resolutions that you might have made for yourself that are always such a battle to keep going. I know mine are always a struggle. My name's Mike Berto. I'm a healthcare economist with Blue Cross and Blue Shield and author of the Straight Talk blog, www.straighttalkla.com, where we share a lot of good information about the healthcare system, how money moves through it, and how we can be transparent with you about the way healthcare spending goes. I have a very interesting job because not only do I get to deal with the public a lot, I also get to build a lot of crazy forecasting models to try to figure out what's going to happen next year and the year after that. And I get to host fun shows like this with fun people. And my fun health co-host today is Shelly Beal. And I'm so glad that you're here with me today, Shelly.
Thank you, Mike. I'm excited to be here. Thanks for having me. I'm Shelly Beal, owner and president of SB Wellness Group. Our team of wellness and fitness professionals, we have health coaches, wellness coaches, exercise specialists, registered dietitians. We've worked closely with Blue Cross, Blue Shield of Louisiana employees and groups for the past 26 plus years now, developing and implementing wellness programs and targeted evidence-based programs like our weight management and coaching programs and many other wellness offerings. And I just love that I get to educate and motivate people each day to live a healthier and happier life. It's a passion. And so I'm excited to be here with you today, Mike, and with everyone on the call.
Well, we're really thrilled to have you. And I have always seen the kind of job that you do as more of a vocation than a job. Because to do it right, you've got to live it and you've got to enjoy it and you've got to kind of preach it and get out there and help people feel better about their opportunities to improve their health. That's a huge deal. For all of you listening today, we just really appreciate you making the time to join us. If you could drop us a thumbs up or a smile emoji in the chat box, or you can put any questions you have as we go through this presentation right there in the chat box. And we'll answer as many questions as we can in the time we have to go. We can post answers also after the event if we run out of time. So if you ask a question and we don't get to it, don't panic. We are going to try to answer every single question that we get. Now, we're still pretty early in a new year, which is a great time to really look over your health plan information and be prepared to use your benefits all year long. One of the things that people often do is they don't really get a good grasp of all of the things their health benefits provide for them. A lot of those are at $0, no cost. So it's really important to know what your health benefits can do for you. Studying that will help you understand all the out-of-pocket costs you're responsible for also as you go through the year. Now, if you switch to a brand new health plan or a Medicare plan, your coverage probably took effect on January 1st of this year, 2022. Even if you stayed on the same plan, a new calendar year is when things reset and any changes you made to your services or your cost sharing, typically that starts on 1/1. And if your health plan has a deductible, of course, co-pays, co-insurance, all of that stuff resets on January 1st. So it's especially important to look ahead. If you know you're going to have a big healthcare need this year, maybe you're going to have cataract surgery, a colonoscopy, a mammogram, some other elective procedures that can run into a few bucks. It's really important to check your health plan information and start looking into how those services will be covered, what your share is, how much you're going to have to pay for those, and whether the healthcare providers you really would like to see are in your network. Very important. I tell people all the time, when you're changing plans or picking plans, you absolutely have to make sure your docs, the drugs that you're on already, and to make sure that all of these things are covered, your favorite hospital are in your network. So taking the time to look ahead really can save you a lot of hassle. So please be aware of those kind of things as you're picking out plans. Now, if you have questions about what's covered on your plan or how to find in-network providers or facilities, reach out to your agent, the person who sold you your Medicare plan in the first place. Or if that doesn't work for you, all the cards that you get from your insurance plan have a customer service number. It's required to be on the phone number. It's usually on the front or the back. And there'll also be a website typically that you can go to if you're not in the mood to have a conversation with someone. So since we're talking about 2022, using our benefits and a healthy start, I'm very bad, Shelley, about making New Year's resolutions. Honestly, January 1 this year, I said, I am going to lose 40 pounds in 2022, which you can't see all of me, but I have 40 to lose. No worries, right? And soon as I made the pledge, I caught COVID. And it's like all of my walking and everything I wanted to do just went out the window. So now here I am a month later trying to regain that momentum. I know that you've got some good information that can help us to kind of reset and get going over again.
Yes, yeah. So it sounds like you had a detour, Mike. That's all. That's how we have to look at
Definitely.
it. Just a detour. New Year's resolutions, this is about the time of year we start hearing people say what you're saying. Life gets in the way. They fall by the wayside. But I love to encourage people to be intentional. So, it's great to set goals, smart goals. I want to lose 40 pounds this year. How you're going to do it, it's something you can measure. But take it a step further by saying, what am I going to get out of that? What will having that do for me? What's my intention? Who do I want to be? How do I want to be? How do I want to feel? Because we all want to feel vibrant, alive, and full of energy, even as we age. And exercise is a key factor in that. It's so important as we get older for so many reasons. One being is that it helps older adults maintain their strength and their endurance and mobility, their functionality as they age. Not to mention that exercise improves just about every physical health outcome you could come up with. It's the best medicine for anything we have, just provided that we don't overdo it or get injured. And we can prevent that by talking to our doctor before we get started, making sure we're starting slowly if we haven't been exercising. And with February being Heart Health Month, getting regular exercise, it's a good time to talk about that. It's a proven way to keep your heart healthy, lower your risk for things like heart attack and stroke. Exercise also, it can improve your mood. Which has positive effects for the rest of your body as well. If your mood is good, you're going to feel more energy. The science tells us that it can slow cognitive decline. Remember, it's better to just do a little bit of something every day than nothing at all. So find something you love that you can keep doing. Walking is relatively easy for most older adults. It's a great weight-bearing exercise. It gives the heart a workout. Classes, structured courses often help older adults stick with an exercise program. It can be a social outlet. Having a strong social network has also been shown to slow cognitive decline. So use your exercise time as social time, and that can help you in so many ways. All of us want to feel connected, to feel supported and loved by others. So this is a great way to do that. And it doesn't have to be strenuous to reap the benefits. Yoga, light housework, gardening, just getting up and moving more keeps your heart healthy and your mind young. So, I do want to mention, Mike, that our listeners can get help from their health plans. Blue Cross and other insurers have programs that help you get more exercise, eat healthy, stop tobacco use. And many of these services are at no cost or very little cost to our listeners. For example, Blue Cross Medicare Advantage members can enjoy the Silver and Fit program at no additional cost beyond your monthly premiums. I love that. Silver and Fit, there's something for everyone. Some perks include no cost fitness center, YMCA membership, and there's also digital videos on their website and their app. So you can exercise anywhere, at home, anytime. So just check out what's available to you, what resources you have. Set an intention to be a more healthy and fit person, someone who moves more, exercises, does it socially. Maybe you walk with people in your neighborhood, whatever will make you happy, and start moving forward with that today.
Well, that's excellent advice. And I think it's also important that we point out that as you get older, I think it's more important that you work in your exercise program in conjunction with your physician to make sure that you're doing things that are within the range that you should be doing for your age and current health conditions. So if you're thinking about how to be healthier this year, it's never too late to start thinking about that annual wellness visit. Health plans cover it. Typically, it's no cost to you. It's something you want to do every single year. Everybody should have at least one checkup a year. People who have chronic health conditions may have to have two scheduled checks a year, depending on your current health status. It's important that we maintain a good relationship with a PCP, with a primary care provider as we go forward. If you have diabetes or heart disease, it might be twice a year, might be 4 times a year, but it's worth it because you really want to see how you're progressing and make sure that you design your activity programs in a way that your doctor says is good for you, is healthy for you. It's easy to
Absolutely.
overdo it, right? It's easy to overdo it. I know the first day everybody goes back to the gym if they haven't been in a while and they start hitting the weights. It's like, oh man, look how strong I am. I'm really having a good time. And then the next day they can't walk because they woke up and angered every muscle in their body at the same time. So really important. Also at these annual wellness visits, they're going to check the numbers that have so much to do with longevity in Louisiana. They're going to check your blood pressure, your blood sugar, your cholesterol. All of these things can go sideways without giving you very much in the way of symptoms. You can have very high blood pressure, have really no idea that you've got it. You don't feel that bad. Your blood sugar can go up pretty high before you start to feel bad. Same thing with cholesterol. You don't feel a thing and your cholesterol is through the roof. So all of these things have to be checked with blood work. And then if they give you daily medication, just take it. I take 3 or 4 pills a day to manage my chronic conditions. I credit those medications a lot for keeping me going this long. I'm 60, but I had a lot of health problems when I was younger. And so I'd hate to think where I'd be right now without the assistance of my docs. Very important to keep us going. February is Heart Health Month, just like Shelley said. You notice I'm wearing my red today in honor of, heart health. Your annual visit with your doc is when they're going to find out, they're going to test your heart. They're going to make sure that everything's working and keeping those numbers in a healthy range. The good thing also, when you have conversations with your doctor, they can let you know about screenings, shots. Another thing, we tend to think of immunizations as something children get. I got news for you. Once you turn 50, there's a whole bunch of new immunizations that you can take advantage of. Not that people love the needles, but when you get a shot to help prevent pneumonia or shingles or tetanus shots. A lot of us haven't had a tetanus booster for 20 years. They don't work anymore. You've got to have them every so often. And did you know that they lowered the recommended age for colonoscopies from 50 down to 45? So you can actually start using your health plan's benefit for a colonoscopy 5 years earlier than you could very recently. Very important to do those colonoscopies and colon screening. In Louisiana, we're kind of notorious for the amount of colon cancer that we have in our population. So we definitely want to kind of intervene and make sure that we're doing something about that. The last couple of years have been very difficult. Shelley, I'm sure you've consulted with a lot of people who COVID really put them off their game.
Yeah.
We also know that a lot of hospitals over the last 2 years, when they've been flooded with COVID patients, had to stop doing a lot of care. They had to stop doing a lot of treatments and surgeries that were not considered life or death or really essential. If you had a procedure or a test or something that was postponed over the last 2 years due to COVID, this is a great time to go and get it rescheduled. We're at a lull in the COVID problem right now. Things are kind of trickling back toward normal. Make your plans early to make sure you get those visits done in 2022. We really don't want to put it off any more than we have to. This is, I think, a good time for me to ask you, Shelley, are there particular programs that you feel like are going to be more useful for folks once they hit 65 and above? What would you focus on the most?
Well, the key is number one. I love that you said check with your doctor. That's so important. You need to know what you should and shouldn't do when it comes to exercise, so you don't make things worse or injure yourself. But I think for older adults, it's important to focus on number one, get that cardio. Whether it's walking, biking, doing water aerobics, something to get the heart rate, work the heart, the cardiovascular system. It's recommended 150 minutes a week. That's, 20 minutes a day if you do something every day of light to moderate activity. And again, I think strength, endurance, balance as we age, these are the things we lose, and flexibility. Those are the things we start to lose as we age. But the good news is if we work on those things, we can keep our flexibility, keep our balance, keep our functionality going. So trying to incorporate some things, even twice a week, doing something that'll help you with balance, yoga, there's chair aerobics classes, all those kinds of things. There's just lots of resources out there for those things. So the key though is do something you love, because you're more likely to do it every day. I have a great neighborhood where we have a very active neighborhood. And
Yeah.
I love to watch how the groups of people get together and walk together, couples walk together. There's some guys that walk their dogs together, and that's it, again, it's that social thing, and they look forward to it. So they're more likely to be out there every single day. So that's important. So just make sure you're incorporating all those things in there.
Yeah, that's excellent. Personally, I love to watch TV. So I had to figure out a way to build exercise into my television watching. So you can't see it, and I'm not going to show you on camera, but right there above my head is a big flat screen TV. And right there to my right is a treadmill. So I can put whatever I want, during the day when I'm working or whatever. I can put on whatever news program I want to watch or entertainment, and I can walk. And honestly, I need the distraction, right? I need to feel like I'm doing something other than just walking and not getting anywhere, right?
Yeah.
But it works for me. And I mean, everybody's got to have their own. I even got a couple of nice hand weights so I can do some upper body exercises while I'm walking, so that I can force it all into one 20-minute, stretch. I'm so miserable at it. But I mean, it's much better than sitting here doing nothing, right? It's going to have benefits.
The key is to move, find ways to move more and to do it consistently. It doesn't have to be hard, and it doesn't have to be long periods of time, but doing a little bit every day is the magic. That is the magic.
Well, I appreciate your magic. I really do. I will tell you this much. Another thing that's really popped to the surface this year is the differences between corrective care and preventive care. These things we're talking about, the exercise, keeping in shape, having your annual wellness visits, these are what we consider preventive care. And if you engage in those, even when you feel fine, you'll discover that you'll put off more serious illnesses and problems much further into your life, further down the road. Not to mention the fact that if everybody did their preventive care, everything would be cheaper. Health insurance would be less. We'd have fewer people having, emergency procedures. It's amazing how corrective care can be so expensive and onerous and really disruptive in your life. And preventive care is not. We got to get out of this mindset. I was raised with it. I'm 60 years old, and I was raised with that mindset that you don't go to the doctor unless you're hurt or you're sick. And when we were kids, it was like, is your fever 102? No, go to school. We didn't have this attitude that you could prevent a lot of things. But now we know better. We're smarter, and we've got health insurance benefits in place to financially support that behavior of having as much preventive care as possible. I wish everybody would take advantage of it, especially when you see how many benefits are 100% paid. You hate to see them leaving it on the table, right?
That's right. It's so important. So important. Don't put off the screenings anymore, the wellness visits. There's no reason to put that off any longer.
Well, yeah, you've definitely inspired me. I'm going to go for a televised walk here in just a minute. And put something on and spend 20 minutes on my treadmill before I have to get back to work. truthfully, it's been a joy to talk to you today. We're really about at the end of our time. I just want to thank you so much for giving us such good information
Thank you for
and for
having
being
me.
such
I
a
enjoyed it.
yeah, for being such a caring person and making this your vocation. I know that it's a lot of work. And people look at you funny when you talk about get up there and walk, and they're like, what is wrong with this person? Leave me alone, right? They don't want to talk to you about it, but it's critical and it's a big deal. And even if you run into old hard heads like me, you should keep pushing, and keep us moving.
I will.
All right. So anybody listening, if you have any questions, drop them in the comments. We'll watch for them. We'll answer them when we get the opportunity to do so. You ought to know that if you want to share this Medicare Made Easy live stream, we're going to do these every month. So we're going to post the video on our Facebook page and on the Blue Cross YouTube channel. And if you haven't looked at the Blue Cross YouTube channel, please do. I am all over that thing. There are videos of me saying the craziest stuff. So go on there and enjoy it. Have a good time with it. We're gonna post this in our future videos right there. You can also see the Medicare Made Easy playlist on the YouTube site, because we've got these going back through 2021. There are quite a few of them. And there's a subscription button. If you punch that, it'll send you an email whenever a new one comes up. So even if you miss us live, you can go back and watch it. We're going to drop information on other upcoming Facebook Live events. Really some good information. It doesn't cost you a cent to enjoy just a few minutes out of your day. You can click on our Blue Cross Facebook page. You can click going, and then you can share those events with your friends so you can watch it together. I think that'll do us for today. Really, thanks so much for joining us. And I hope all of you have a wonderful day. Get up and walk, because that's what I'm going to do in just a minute.
All right. Thank y'all.
Thanks.